Good morning, everyone. It looks like we still have a couple of people logging in, so I'm going to give it another minute here and then we can get started. All right, I think we can go ahead and get started. Good morning, everyone. This is the COVID-19 Recovery Committee. Before I review the agenda, want to take a moment to welcome Sunny Weathers, the new mayor for Airway Heights, and also Liberty Lake Mayor Chris, and I'm probably going to mess up your last name, Kaminskis.
Perfect. I still struggle after 25 years, so good job.
Thank you. Thank you. All right. Got it. So welcome to our group. We meet every Tuesday morning to talk about the COVID-19 response, what's happening in the community, and next steps. So we have added both of you to the list of attendees, and we'll update the agenda to have you listed as attending mayors, and going forward, you'll get all the materials as well. So a reminder to folks who are calling in or who are on the GoToMeeting to please mute yourself if you're not speaking, so that we can minimize feedback when others are speaking. So today we have Steve giving the dashboard report, the health officer update with Dr. Velasquez. Lindia will give a report on general response updates, and there'll be more discussion of the vaccine, I'm sure. GSI will have a report from Alicia or Kara. Does anyone have anything they would like to add for open discussion items? Okay, I'm not seeing anyone.
You've got one person that's not muted before we get going, and there's an interruption.
Okay, caller one. Oh, looks like they just muted. Thanks, Doug. Thank you. Okay, so if you think of anything that we need to make sure we discuss, please, you can send a message in the chat and I'll grab it. So, Steve, let's get started.
All right. Good morning, everybody. Mostly positive looking data so far. So for the week of January 17th through 23rd, we had 1,432 new cases. We had 2,011 the previous week, taking our daily average down to 204. The average was 287 the prior week. Of those cases, 1,374, 96% were confirmed, so the PCR tests, and 58 were probable, so the antigen tests. That is a significant decrease. Our 2-week total, so that's between January 10th and the 21st, or January 10th and the 23rd, was 3,443. With those, 3,317 were confirmed. The prior week total was 4,290. So again, a significant decrease. Of those impacted for the age group, it's still about 75% are within the working age adults, age 20 to 69. No real significant decreases anywhere else. Again, our rate for the past 2 weeks was 668. That's a very large decrease from 833 last week when I reported. If we do that non-adjusted, so just confirmed cases, that is 643 as opposed to 803 the prior week. Hospitalizations were also down. We had 39 new Spokane County residents hospitalized between the 17th and the 23rd. There were 48 the previous week. Currently hospitalized at our major systems are 105. So that's Spokane County residents and others. Unfortunately, we did report 19 new deaths last week, including an individual in their 20s, an individual in their 40s, one in their 50s, 3 individuals in their 60s, 5 in their 70s, 4 in their 80s, and 4 over the age of 90. That's a slight decrease from 20 the previous week. Our testing numbers have gone up in a good way. The prior week, so this is actually January 7th through 13th, we administered 9,216 tests. The prior week, there were 7,711 tests administered. That takes our average number of individuals tested daily up to 1,317, which is an increase of 200 from the prior week. And our positivity rate has decreased to 19.4% from 25.8%. So it still remains very high. For our healthcare system readiness, that's the hospital readiness and their beds available. There are 1,060 staffed beds available, which is an increase, and licensed beds remains the same at about 1,501. Of those, for staffed beds, there's an occupied census of 84.4%. Licensed beds, that's 59.6%. Our total COVID census is 9.9% for staffed beds and 7% for licensed beds, and there are currently 8 surgery overflow beds in use. For case and contact metrics, we investigated 739 cases in-house, which is just about the same as always. We reached about 61% within 24 hours. For our care coordination, that has actually transferred over to Better Health Together. I'm working with them to get the data. It looks like I fell off there, didn't I? The isolation facility, there are currently 13 individuals at the hotel facility and 11 at the Immaculate Heart Retreat Center, which is a lower census than we've been used to. Our business technical advisors continue to see individuals in the community for our businesses in the community. To date, they've reached 5,578, done 5,578 consultations. Between the 17th and 24th, they completed 171, bringing their referrals up to 5,356. For food security, in the prior week, there were 423 new applications for EBT, which is down. And the week before that, Second Harvest distributed about 400,000 pounds worth of food. In our childcare metrics, with about 1,364 slots open. And then finally, for unemployment insurance claims, the prior week, there were 1,298 claims for new insurance. Unemployment insurance industries impacted most are food services and drinking places, specialty trade contractors, and social assistance. The final metric to report today is that the outbreaks in long-term care facilities, to date, there have been 80. 50 of them are considered still in outbreak status, which is just an increase of 2 new facilities over the past week. And that concludes my report.
Any questions on the data for Steve? Okay. Steve, Steve, looks like we don't have questions yet, but we may in a minute or two. Sometimes it takes a minute for that data to sink in. Dr. Velasquez, do you want to go ahead and do your report, please?
Sure. Good morning, everybody. And thank you, Steve. So before I do my report, I just want to comment on a couple of things. As Steve mentioned, some of our numbers have improved, which I think is good. And we're tracking the rate per 100,000 every 2 weeks, starting as of last October, because I would like to get some predictability out of it. That's the good news. The bad news is, or the not so good news, I won't say bad news. The not so good news is that when we zero in on very specific age groups, like the 20 to 39 or so, we really have 1/3 or more of the cases. And that worries me a little bit because these are the younger people that are either in school, working, have part-time jobs, work at the restaurants, etc. And they account for a significant number of the cases. So my call out to them is to be mindful and be careful. I know that we all, when we were 20, we probably didn't pay as much attention to some things as we do now, or at least I am. But I do believe that if we start to manage that a little bit more assertively, and me as a parent, I'm doing that, so I'm sure that we all are. I think if that third starts to calm down, I think the numbers are going to start going in a much better direction going forward. So that's kind of like my ask of all of us. And that is, I made that ask for employers, for example, make sure that all your employees and all your customers are following the rules to the best of our ability. So anyway, just one comment on that. And that becomes particularly important as over the next few weeks, we're going to start talking about the variants a little bit more. And the variants, although there's no cause for alarm, is something that we need to track, mainly because what the variants share in common, although there's some differences, is that they're more contagious. They're more effective at infecting others just based on their biology. So that's why I want to be sure that we're doing as much as we can, particularly in those age groups that are more exposed because of their activities. So going back to my report, number one, we've been doing a number of presentations around the community as part of our efforts to increase our communications. And we've been on the road, although virtually on the road. And the aim of these presentations is to share as much information as we can about areas such as vaccines, which is an area that there's a lot of questions, as well as some of the areas in which the Spokane Regional Health District has been involved over the last few months in terms of initiatives, whether it's education or testing or any of these other areas. So we continue doing that. We have a number of other presentations all the way from here to, I would like to say, mid to late February. And we do appreciate the invitations. I think it is important that we are able to speak with as many people as we can, because the more we share information, the better we all are, particularly as we talk about the public health guidance. That's number one issue. Second issue, we continue our efforts to expand testing, particularly rapid testing. And as a result of that, last week on our testing task force, we set up a couple of work groups that have very specific focus, one of them being childcare and similar industries, because that is an area that we could certainly assist with rapid testing. The second one is retail and hospitality. And that requires its own focus of attention because of the activities that occur in those places that are a little bit different than any other industry that we have. And then lastly, we relaunch an equity task force with a broader representation, deriving benefit from the equity task force that the Spokane Regional Health District has been running. And we're looking forward to the work on that one, because this will address particularly some of those communities and some of those community groups that may not have as much access or may have other issues which translate not only from testing, but translating to vaccine hesitancy. So we're trying to tackle kind of like both at the same time, utilizing the same group of people. So we're very grateful to all of our community members that have come forward to work with us on that. Then the last update that I have, the last piece of my update is we continue working on education. As you know, we have developed some guidance on special education, particularly children that or students that are not able to wear masks in classrooms, which is a very specific group. We did the bigger groups. Now we're focusing on those that need a little bit more attention. And we will see more than likely deployable rapid testing for those classrooms to help manage the potential of spread in there. And we're very excited about that. I do have to tell you that we had the report out from our various work groups on Wednesday. I'm losing track of the days, on Wednesday or Thursday, I can't remember. It's been a long week. And on the preliminaries, our education work group is moving along really fast, which is good because we wanted that group to move quickly as we bring and onboard more students. So more to come on that. The schools, because of their infrastructure, many of them have school nurses and other trained professionals, were able to work with them in an environment where we could deploy testing to them. And they can perform the testing on site, which is a lot more effective in terms of rapid disposition. So we're very excited about that. And we're also providing specific guidance in two areas that are a little bit more complicated. One of them is music programs and choirs. Because if you look at the guidance from everybody from the American League of Orchestras to the various organizations and the governor, is a little bit complicated just because of the diversity of instruments, but as well as the diversity of vocal opportunities or vocalization opportunities. But we have what we consider to be really fairly good guidance, because we would like our students to be able to experience other activities. Not that the classrooms are not important, but we all like traditional education. And then lastly, one of the biggest areas that we have spent a lot of time and will continue to spend time, but we have some guidance, is in sports within the limitations and restrictions that are there. So we have our meeting with our school superintendents on Wednesday, superintendents, principals, and school officials, so we can go over some of those and start to move those forward. So that will really complete that work that we started in late December in terms of onboarding students back or providing guidance to onboard students. These are three areas that we separated as to provide very specific guidance as information became available, not to stop the process of onboarding students into the average classroom, as opposed to some of these other areas that are a little bit more specific. So with that, I'm going to stop here and see if there are any questions. I think Lindy is going to talk about vaccines, and I know that's probably the biggest question that we'll have, and we have lots of answers and also a lot of questions. And I was doing a presentation earlier this morning, and actually with Mayor Wick, and one of the questions was, and threw me through a loop, I heard that we have 30,000 doses at the arena. We're like, well, actually I think it's 3,000, but we will love the 30,000. If we could get it, we could move it. And this is probably the challenge. We do have the capacity, we have the infrastructure, we do have the methodology to just go forward. It's just waiting for that, the day that we actually get 30,000 in one day. That would be a great day. I do have to say that as a state, and not to steal Linda's thunder, but we're very encouraged because we were at 15,000 per day when we started this a week ago, and we closed yesterday at almost 24,000 for the state. So we're inching forward towards that 45,000 goal that we all hope we'll get very soon. So with that, I'm going to stop and see if anybody has any questions for me. Well, thank you. I'll be here in case something comes up later on. Thanks, Amelia.
Yeah. And Lindy, I think you can just hop right in.
Okay. Well, good morning, everyone. I'm going to give a few other updates and I'll leave vaccine to last because, it's the cliffhanger. So isolation and quarantine facilities. We continue to have individuals at my place and the Immaculate Heart Retreat Center. The safety officers did do a recent inspection of both, and they're going really well and have been very open to any suggestions on safety issues or changes. We will be needing funding to continue these facilities beyond March, so that's always a concern. And the expectation is that federally we'll be getting some additional funds. The federal oversight is shifting from FEMA to HUD for isolation facilities. So we're not sure what that means, but it might have some different requirements or reporting concerns. The safety officers also did some inspections at 2 shelters for the city, and we've seen a great improvement from when they first went out there to the recent one, and we will continue doing those as needed, but probably not weekly. Care coordination, Better Health Together is up and running and taking on all of that work, and really are able to do more around the financial assistance piece for families, so that is great. We are working with them to try to get a weekly report for the recovery group, so I hope to have more information from them in the future. And then some of our staffing that we have reassigned, we are trying to get back. So for example, environmental public health is starting to see more and more need to have our staff be back out in the field, either for restaurants or the pools or the gyms. And so we're trying to get them back out of COVID work and into their regular jobs. The difficulty there is hiring more staff for COVID is difficult because our funding really is only stable through about another 3 to 6 months. And so hiring new staff can be a problem. Okay, so vaccine. The mass vaccination event at the arena opens tomorrow, and Chaz has done a great job as operational lead in pulling everything together. They are putting out a press release today that has a lot of really good information about how they were planning this event even prior to the governor announcing that we were a mass vaccination clinic. And they're working very well with the National Guard, the Spokane Arena, and the state, and our own agency. They'll be operating under Dr. Shah's authority as State Secretary of Health and using the Moderna vaccine. We do have 3,000 doses, and there will be about 500 provided daily. We are one of the only sites that will be operating 7 days a week, instead of just 5 days a week. Chaz wanted to keep it going. They will be required to report daily on vaccine administered and doses available, and that will be all through the governor's dashboard site. The model that they're using, since this is going to be the 65 plus group that'll be coming to the arena, is the sit model, where they actually are sitting in chairs and all the services come to them. So the paperwork, the vaccinations, everything, so they don't have to be mobile. The state did assign us a state liaison that we're working with to kind of make sure that we're all on the same page together. And the state is also providing us about 10 staff to help get the records into the immunization registry. So we won't be backlogged or not have current data around that. Our vaccine team continues to work on a variety of other efforts. We have held school clinics with East Valley and West Valley. Central Valley is having one, Meade and Spokane Public Schools. we're working a lot with our shelters and our long-term care facilities. So about 160 of 320 of our long-term care facilities signed up for the federal pharmacy program, but that means about half of them did not. And so we are sending out vaccinators to get the rest of those agencies vaccinated. Our staff continued to look at gaps for access issues and did identify Cheney as one of the areas that could use some extra focus. And the staff are working with the Fire Training Center to hopefully open up something out there. Healthcare systems, the pharmacies, they're continuing to provide vaccines as they get their supplies in. Some of them are using it in their clinics, and then you may have heard about the drive-through clinic up at Deaconess Health Education Center. I know Providence is working on a drive-through clinic. And again, like Dr. Velazquez mentioned, it's all based on how much supply of vaccine we can get on how these facilities can keep running. Our EMS will do their second dose clinic in February. I think it's the 5th through the 12th. And we are also talking to some of the fire stations to continue doing some other vaccinations through those sites. Through our Medical Reserve Corps, we had over 240 individuals sign up, which is great. And most of those individuals, I would say about 200 of them, have the capability to actually vaccinate. So the other staff will be for logistics and, greeters and help with paperwork and all of that. They've already been utilized at the school clinics, the cancer centers, and Chaz's mass vaccination is going to use them. And then Multi-Care used them at the Deaconess drive-through center. So they've already been utilized. And then our equity work, we have been having many discussions with different groups around gaps potentially and access issues. The staff are working really hard to look at those gaps. We've been talking to Betsy Wilkerson about the East Central area and figuring out maybe a way to have a mobile unit come through there, since the East Central Community Center does not have a clinic. It would be a gap community. And then our community health workers that we hired for care coordination, we're kind of shifting them to now help with outreach to different populations that may be more hesitant to get the vaccine, and utilize them for communication, messaging, finding some champions in those communities that can show how they got the vaccine and really help get the uptake in different communities. So the last thing I have is our staff, and probably you also, get many requests from different groups wanting to be prioritized with the vaccine. And we are really trying to stick true to the priority phases, the tiers, and kind of make it equitable for those groups to get the vaccine first and not put other groups in front of them. So the messaging really is that we are staying true to that guidance, and that it's all based on risk, whether an individual has an occupation that puts them at risk, or the audience or population that they work with is at risk. So highest risk to lowest risk, and trying to be equitable to all groups. So any help with that messaging would be appreciated. Facebook Live Wednesday will be about vaccination efforts. So 10 o'clock on Wednesday, if you want to listen in. And then, like Dr. Velazquez mentioned, we are continuing with our presentation to different groups and have some more this week and into February. So I think that's it, unless there's questions.
I'm not seeing anyone unmute, Lindia. So thank you for the update. There may be more questions that come up. Yesterday, Dr. Velasquez, myself, Chaz leadership, and Stephanie Curran and her staff did have a call with the governor. And one of the things, that I think is really a big asset to our community is really having the strong public facilities district. They're really looking at the mass vaccination site and running it like an event, and thinking through it with, all of the things that the security and having EMS there and just all the things that you would do if you were running a large event, which a mass vaccination site is in a community. So that's really a great thing in our community to have a strong public facilities district. And the other thing I would add is I think that the unanimous feedback to the governor was we've really got to get more doses of the vaccine here because we have all the infrastructure, but we've got to have the doses or where, we just have the infrastructure and we won't be able to get everyone vaccinated. So just wanted that if you see Stephanie or her staff or interact with them, they're doing a great job along with Chaz to get this up and going. So I'll segue over to GSI for any updates you might have.
Thanks, Amelia. I was going to add, it's actually more of a comment probably than a question before I just touch on a couple of things. There's so much around vaccination. And so as things begin to, as Wednesday begins to happen and those kinds of things, if there is a shared set of, 3 or 5 bullet points that each of, all of us could be articulating around that for clarity purpose, I think that would be really helpful. Because I was saying to Frank earlier, I get those text messages. What's the plan? How does it look? And so I think if we're able to lift what's happening and what's coming to our various different audiences at across the board, that'll be really helpful for the community as we continue to push forward and the really great work that's happening, but driving clarity for everybody. So just a comment on that.
Yeah, no, I think that's a great suggestion. And I know Kelly's listening in, so we can touch base on that. I know, I've even been trying to send out to the Board of Health just the messages we get from the state, because one of the hard things I think we've all experienced with COVID is that it just changes so quickly. So as soon as we send out one set, it feels like it immediately changes. But I think that's a good point if we could get maybe some of the basics of, how it'll be by phase or Kelly and I can kind of talk about that. So I think that's a great suggestion.
And it may change week to week, and we have responsibility to communicate with our audiences as that information is changing too. So, okay, just a handful of things. First, I want to thank Dr. Velasquez. He was presented at our board meeting yesterday around all of the different pieces he touched on in his report and we've been talking about today. So thank you, Dr. Velasquez, for that. And I think it was extremely helpful. Good questions across the board as we think about testing and vaccinations and school reopening. And I'd be remiss to say on the school reopening pieces, just a thank you for that work as well. And I hosted the Central Valley School District Community Conversations last week, and a huge kudos to the health district team. They mentioned that throughout as far as helping them be able to create consistency and get their students back in. And just a friendly reminder to make sure we all vote by February 9th. And then upcoming today, Kara and I, our state partner, the Association of Washington Business, has their both advocacy day legislatively, but also we have our board meeting this afternoon. And so we have both the Secretary of Health and the governor on our board meeting this afternoon. And so if there's any specific things that would be helpful from a Spokane perspective for me to share with either of them, please just shoot me a note and let me know, because we have about 30 minutes with both the Secretary of Health and the governor this afternoon. And so happy to reiterate some pieces on behalf of the region. And then I'm going to toss it to Kara to touch on a couple of legislative pieces. But the other thing I would just note is that, as you hopefully saw, the Democrats dropped their COVID package late Friday. And so from our perspective, as the ADO, we're already engaged with the Department of Commerce around the small business and nonprofit relief pieces that are in there, as Commerce will be the mechanism again for that distribution. And so what will that look like from a grant perspective or otherwise? So a lot that's unfolding there as that package works its way through the legislature, but hopeful that by early February, we have some early and additional resources to continue to infuse into the sectors that are needing that assistance where we find ourselves at this point. So those are the handful of things on my end. Kara, do you want to touch on a couple of the legislative pieces?
Yeah, thanks, Alicia. Good morning, everyone. Really, I'll just share a couple things that we're tracking and watching that are pertinent to this group. Last week, there was a restaurant bill. It's Senate Bill 5114 that it's actually, they're doing hearings via Zoom, which is actually providing Eastern Washington a lot more access, which is very, very good. And I'm hoping that they keep that procedure in place. But there were 1,600 folks signed up to testify on that bill, but between 20 and 30 from a timing perspective actually get in. And we had 4 that I know of from our area that a couple of them we helped prep, and then we had 4 of them that were testifying on that bill. So we're watching that one closely. That is the one. We have 3 senators on the Senate bill and 1 representative on the companion House bill that are from Spokane County that are supporting this bill. And so we're watching that. It essentially opens restaurants to 25% immediately. So it kind of bypasses phase 1 for restaurants. If you're interested, I'm happy to pass along any more information on that one if you'd like. As Alicia was mentioning, we're waiting some real detail on that, on the governor's package for the relief that they announced over the weekend. What we're also watching closely is there's been 2 transportation packages that have been released. They're substantial. And there is another one expected from the Senate. So we're keeping track of that too. And really our message from this region is north-south corridor, keep it on track or earlier, keep the funding there, and really double down on preservation and maintenance dollars for this region and across the state. So that's pretty high level, but those are the couple I wanted to share. Any questions on those?
Kara, with 1,600 people that signed up there, what's the reception of Senate Bill 5114 by the majority party over there?
It's interesting. There are a couple Democrats that have signed on the Senate side. Senator Mark Mullet, who we've worked with before, GSI has worked with before. He was the prime sponsor of the .09 bill last year. He's a pretty moderate Dem. I think primarily it is mostly Republicans on both the House and the Senate bill. I don't have a feel for how that, for the after, how that went. I wasn't able to listen to the whole thing, but I am happy to, let me talk with Jim Hedrick and see if he has a feel for what the process, where that's at. Expect that to probably go into and have a hearing in the next committees as they're passed out, but no votes have taken place yet, so not sure. I'll find out though, Commissioner. Thanks.
Other questions for GSI or any other discussion items? Okay, it looks like just over in the chat, Kelly and Lindia have piped in with some of the discussion on messaging. If you need to direct people to the website until we get some bullet points put together. I know we've been working to keep all of that updated as soon as we get information. Not seeing anyone with questions or anything coming through in the chat. Go ahead. Yep.
Yeah. If I could ask just one more question. I saw and I'm sure many of you saw it as well. I've been contacted by a few constituents that saw a CREM news coverage on that the state for some reason is using kind of outdated data sometimes. The way CREM reported it, sometimes up to 3 weeks. 3-week-old data to determine on whether each region can advance to the separate stages. And I know how Steve's got very, very up-to-date data that he shares with us every Tuesday. And why is it that the state can't utilize the data that we're being presented on these Tuesday calls?
Yeah, I can chime in there. So what the state is saying is that they want basically the cleanest data possible. It's the trade-off that we give. As you notice on our website, even day to day, our case counts will change just a little as we clean things up, remove duplicates, add folks or remove folks from out of town, confirm labs, those ends. And so the state is really being as cautious as possible to get what they would consider the most accurate data as possible. So it's bound to be a couple weeks behind for us, and that's what their rationale for doing that is.
Okay, and then I also in that coverage they were saying as far as the testing positivity rate metric that's used to measure, they're thinking of using one location and using their one testing site's location and using that as a sampling. To determine the positivity rate as far as that metric goes. Do we know what location or what testing facility they're considering using for that metric?
They haven't contacted us on that, and I don't know that I could even point them to one that I would say is the best sample.
Okay, thank you.
Could I comment on that? That's called Sentinel, is a Sentinel approach that has been discussed, and it has pluses and minuses like any other approach. If you think about the Spokane County region, probably half of the testing right now for diagnostic purposes being performed by the Inside WSU partnership. So but that is only one segment of the population. And when you use a Sentinel site like that, it may or may not be representative of the total activity in the population. We do have at least one partnership that does a lot of the testing, but that does not reflect the total activity. And that's kind of like the trade-off with that. We don't have any more detail than that, but just to let you know that if that were to happen, we certainly could identify potentially a site or sites that have the largest volume for all, with the caveats of the trade-off of it may not be totally representative because all of this testing is referred. So it's referred to them, and that's kind of like the advantage when it's referred. It comes from many areas in the county, not just one site, but it may not represent all the clinical activity in the healthcare partners and so on and so forth. So there's pluses and minuses to every equation. But we've heard the conversation. We don't have any other information, and we certainly will follow up closely.
Any other questions or follow-ups before we adjourn? All right, well, thank you, everyone. Appreciate your ongoing support, and we'll keep everyone in the loop as much as possible related to the ever-changing vaccines situation. And same time, same place next week. So thank you, and don't hesitate to reach out if you have questions. Have a great day.
Thank you.
Bye-bye.